Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Hassan Eidi, cardiologist from Idlib, Syria, speaking to you about the situation here.
How worried are you at the possibility of an outbreak? Is that a real concern of yours?
Of course, it is, because we here have so many crowded camps with unhealthy circumstances. Also, some cities are so much crowded at the northern area near the border with Turkey, as people who were displaced from Saraqib, Al-Mara, and cities near these are living there. Now we are in the ICU. It's supported by the heroic hearts. It serves to help people who suffer from injuries at the last period. But now, as we know, the globe are facing this pandemic, COVID-19, and we are here so much afraid that we have it. If it is the case, it will be disaster, because it's very hard to isolate people. We don't have isolation units, and the camps are so much crowded. If you want to isolate patient at home, they don't have home already. They are living in camps. We can say about 20 people are living at the same tent. So we should be prepared to face this catastrophe. Heroic Hearts now are preparing isolation units to be ready to receive people with suspected or proven corona. We hope that you can help with this: protective clothing, nebulizers, drugs. The most catastrophic thing in this, I think, that many people, especially those with chronic diseases, elderly people, will suffer from respiratory failure, and they need ventilator. We don't have those ventilator. Everyone, unfortunately, cost about $3,000, and Heroic Heart promised to help in these. So if you can help to donate for Heroic Hearts, it will be grateful for you.
We'll bring in our panel in just a moment, but first we're joined by Dr. Hassan Eidi, who's a cardiologist at a hospital in Syria's northern province of Idlib. Dr. Hassan, thanks very much for speaking to us on Inside Story. So, of course, officially, Syria has so far not recorded any coronavirus cases. In your assessment as a doctor, though, what is the risk of an outbreak in Syria, and particularly where you are in Idlib?
Now I'm living in the northwest of Syria, Idlib, and it's somehow isolated from the outside world, but just a few numbers of people could cross the border to Turkey, go and come, and also the border with the regime area are nearly closed, but some people also can go and come there. So if we are going to get it, there are two sources: from the regime area and from the Turkey.
How worried are you at the possibility of an outbreak? Is that a real concern of yours?
Of course, it is, because we here have so many crowded camps with unhealthy circumstances. Also, some cities are so much crowded at the northern area near the border with Turkey, as people who were displaced from Saraqib, Al-Mara, and cities near these are living there.
Yeah, we've often reported on the state of hospitals in Idlib, where you are, which, of course, as you're saying, have suffered due to years of war. So what would an outbreak then mean for the hospital's ability to provide care?
We know that hospitals there are not that hospital compared to those in developed worlds. They are new hospital, and they are working in bad circumstances. The resources are rare. The consumables which we need are not available all the time. So if such outbreak happens, in fact, we can't do so much to prevent it or to control it. We don't have wards available to isolate patients, suspected or proved patients. We don't have facilities to prove the disease. We know if it happened, many people will suffer from it, and those patients should be treated, should got nebulizers. Many patients will suffer from respiratory failure, and it's the main the West because they need ventilators, and we already don't have these. For example, our hospital with the ICU unit just got one ventilator, and it's not working in proper way.
What about the most basic recommendation when you hear the advice from the World Health Organization, for example, that people just must wash their hands? How difficult is that simple thing to do in Idlib, where you are?
It's not so much difficult, but if you want to advise all people to do these advices, it's not easy. In fact, you know, we try to educate people about corona and its ways of spread, and try to assure them that it's not so much a dangerous disease. And in fact, it's not a dangerous disease, but the problem that it spreads in a horrible way. So if it started, the problem in stopping it, washing hands, keeping far away from patient with the respiratory tract infection, with the suspected corona disease, COVID-19, is the ways to prevent it. But how could we convince people to take these measures, especially those people who live in the crowded camps where hygiene is not good?
Right. Okay, we'll leave it there. We thank you very much, Dr. Ihsan Aidi, for speaking to us from Idlib. Thank you.
Thank you.